Hi, I'm Peter Glowicki from Mayo Clinic, editor-in-chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to bring you the May issue of this journal with several excellent papers on venous diseases. The editor's choice article this month is on the effect of commercial insurance policies on outcomes of venous ablation, authored by Cassius Clay Ochoa-Char and colleagues from Yale University School of Medicine in New Haven, Connecticut. The authors retrospectively reviewed criteria for coverage of 5 insurance companies and correlated it with outcomes in 253 patients who underwent 341 vein ablations. Criteria for coverage were different for each insurance companies. The diameter of the ablated vein was determined by 3 of the 5 companies, and duration of pre-operative conservative management ranged from none to 6 weeks and to 3 months. Clinical success was independent of coverage criteria, and more stringent criteria likely denies treatment of many patients who could benefit from intervention. Potential denial of coverage for successful procedures ranged from as low as 5.6% using criteria of Connecticut Care to as high as 64.1% using criteria of United Healthcare. Findings from this study provide insight into the current status and impact of commercial insurance policies on treatment of vein ablation in chronic venous disease. You can earn CME credit by reading the next paper that you can also download this month free of charge. Our CME paper in May is entitled Systematic Review of May-Turner Syndrome with emphasis on gender differences. This was written by Christoph Kaltenmeyer and colleagues from Pittsburgh, Pennsylvania, and New Haven and Storrs, Connecticut. These authors reviewed data of 1,569 cases of May-Turner syndrome, published in 137 articles, and found that May-Turner syndrome is at least twice as frequent in women as in men. Gender comparison, available for 254 patients, showed that men were significantly older, had more leg swelling and pain at presentation. Deep vein thrombosis was equally frequent presentation in both groups, but women had significantly more pulmonary emboli than men. The authors also discussed treatment modalities and call attention to the terminology, emphasizing that May-Turner syndrome is the most frequent form of the non-thrombotic iliac vein lesions. The next article is entitled Patency Rates and Clinical Outcomes in a Cohort of 200 Patients Treated with a Dedicated Venous Stent, authored by Dr. Van Buren and colleagues from the Netherlands, Turkey, and Germany. This international group of investigators studied the dedicated sinus venous stent implanted in 200 patients in the iliac or iliofemoral vein position. Stenting significantly improved the Villalta score, the venous disease severity score, and the venous claudication of the patients, and resulted in an overall primary patency of 68%, assisted primary patency of 83%, and secondary patency of 90% at a median follow-up of 12 months. The authors concluded that instant restenosis and occlusion still occurs, but these stents resisted very well any kinking or tapering. The final paper we would like to introduce you now is entitled Differences in Radial Expansion Force Among Inferior Vena Cava Filter Models Support Documented Perforation Rates, written by Eli Robbins and colleagues from the East Carolina University Broad School of Medicine, Greenville, and the Department of Mechanical Engineering Technology at Penn State Bear and Erie, Pennsylvania. Now, this is an in vitro study, and they found that the Cook Select, Platinum, and Greenfield inferior vena cava filters had differences in radial expansion forces consistent with published perforation rates. The largest radial expansion force at minimal caval diameter was seen in the Platinum filter, followed by the Select and the Greenfield filters. Radial Force dispersion during expansion was greatest in the Cook Select filter, followed by the platinum and the Greenfield filters. So these data explain the relatively lower perforation rates seen with the Greenfield filter versus the 2 Cook filters that were included in this study. These were just 4 of the many excellent articles from our May issue. To access these articles free this month, please download them on www.jvsvenus.org. Enjoy reading all JVS journals and let us know if you have any comments or questions. And see you next time for the highlights of the July issue of the JVS Venous and Lymphatic Disorders.